Good sleep is good medicine, but 100 million Americans have trouble getting a good night's sleep, and that can really wreak havoc on their health. I'm glad you're here as we learn a little bit more about the importance of sleep, sleep studies, sleep trackers, and then what you can do to get that good night's sleep so many of us need. And our guest this half hour is Dr. Seema Khosla. She is with the North Dakota Center for Sleep in Fargo. Thanks for being here.
Thanks for having me.
Okay, so let's talk about how does a sleep disturbance affect my overall health?
You know, it's funny. Sleep is one of these areas that we really do consider to be the third pillar of health. So we have nutrition, we have exercise, and we have sleep. There's a lot that goes on in our sleep. Sleep is very important for restoration. And if you don't get enough sleep, that impacts our mood, it impacts our memory. And so it's a lot more significant, I think, than people recognize. You know, we're all very good at recognizing acute sleep deprivation. You're up all night with the baby, you are on call, something like that. But so then we get that we are sleep deprived, right? We're not as good, though, at recognizing chronic sleep deprivation. So the people who get maybe 6 hours of sleep a night and who feel relatively okay. And that's the group, I think, that we really need to pay attention to.
Oh, good place to start. So how do I know what's going on in my sleep? Other than a sleep study, are there some clues that I should be paying attention to that I'm really not getting the sleep I need?
You know, what's so funny is I think, we love all of this technology. And I think our natural instinct is to buy something, right? To tell us about our sleep. And sometimes we just go back to the free stuff. So how do you feel in the morning? Are you rested when you wake up? Can you make it through your day? Are you yawning? Are you inattentive, right? So we just bring it back to the clinical part. And the important distinction is, let's say you're getting adequate hours of sleep, right? You're hitting your 7 to 9 recommended hours, but you're still tired. That's when we really have our antenna up to say, well, could there be an underlying sleep disorder here?
And sleep disorders come in a lot of different shapes, sizes, and forms. So let's focus on just a couple of things, arousals and awakenings. What's the difference and what do I need to understand?
So an arousal is just a shift in the EEG. So when we do overnight sleep studies, they're called polysomnographies, we do a lot of measurements. So we look at your brain waves, we look at your heart and your lung and your breathing and your oxygen and that sort of thing. When we're looking at those brain waves, we look at everything 30 seconds at a time. But then sometimes within that 30 seconds, there's a 3-second shift in your EEG where it looks like you're trying to wake up. That's called an arousal. And so you often will go back to sleep and you may not even recognize that something has happened, versus an awakening is that same sort of thing. You have that shift in your EEG, but you do then wake up. So it's bigger, it's longer, and more people will remember those.
So an arousal, does that interrupt the restorative quality of sleep? And what's normal versus what's a problem?
It's okay to have an arousal here and there, right? None of us sleep perfectly. We don't all read the book and follow our sleep the way that the book says that we should sleep. It's when our sleep becomes so choppy and so fragmented that we keep waking up and we lose that continuity of our sleep. So our normal sleep will follow what's called a sleep architecture, meaning light sleep, deeper sleep, going into REM and so on and so forth. And you do cycle through the various stages of sleep through the night. If you have a lot of arousals, though, oftentimes that doesn't allow you to progress into deeper sleep. And so it's almost like nodding off on a bus, right? Or skipping a stone over sleep where you're really hitting the light stuff and you're not getting the deep stuff. And so then you may be getting your 7 to 9 hours, but because you're not getting into the deeper levels of sleep, that sleep itself is not restorative.
Got it. So it's really about the quality of sleep as opposed to, so it's a dual factor, right? You have to get enough and it has to be of the right quality. So do we know?
And the timing.
Tell me about timing.
So when we look at sleep, we assess timing. So are you going to bed at the same time every day? Are you more of a night owl? Are you an early morning person? And does your sleep schedule match that? Duration, like we've talked about, quality, and then regularity. So maybe you're really good about going to bed at 10 o'clock Monday through Friday, but then you stay up late over the weekend, and all of a sudden you can't sleep on Sunday night because you're out of your regular rhythm, right? And so then your brain's not ready to go to bed Sunday night at maybe 10 o'clock at night because you've already been staying up until midnight or 1 on Friday and Saturday.
Yeah, I've heard that referred to as sleep hygiene. You want to be very careful and have that regular schedule 7 days a week. Your body depends on that. So during the deep phase of sleep, so let's walk through those. The first phase of sleep is a light sleep. It lasts about 5% of the total time. I understand that. That's when you're just falling to sleep. And then you go through and you want to get to deep sleep. What is happening in our brain during deep sleep and why is it so important?
So, you know what's really funny is that I think there's this natural implication, especially since we have so much consumer-facing sleep technology. The implication is that we should spend our entire night in deep sleep, and that's just not true. And so it's important that we do cycle through lighter sleep. So the sleep that you described, we would call N1 sleep or non-REM stage 1, and that's that transition sleep, where you're not sure if you're awake or asleep. But then you do go into stage 2 sleep, which is considered light sleep. But it's really interesting because in the sleep architecture, when we look at the brainwaves, you will see these little bundles. They're called spindles. So it's a really tight alternation in your EEG. And we think that might be what actually blocks out sound waves so that you can sleep. And that might be why your own snoring doesn't wake you up. And so that's important. And then we cycle through what we call deep sleep or stage N3, non-REM sleep, stage 3. These are where we have these wonderful, deep, long, beautiful, big waves. And so this is our slow wave sleep. This is where we download our short-term memory into long-term memory. Kids get tons of the sleep. This is where they grow. But then we transition to REM sleep. And so REM sleep is our dream sleep. It's where we have these really vivid, watching a movie kind of dreams. And so it's really important that we hit all of them. So we know that deep sleep or stage N3 sleep is really important for memory, right? REM is important for mood, but some recent data shows us that REM actually helps us organize our memories so that you can fetch them when you need them.
So there are people who have trouble falling asleep, and then there's people who have trouble staying asleep. Are those two different things? Two different disorders?
They both fall under the umbrella of insomnia. So we would categorize it as sleep onset and meaning difficulty initiating sleep, and then sleep maintenance insomnia, meaning difficulty maintaining sleep. Can you have both? Absolutely. Can you have just one or the other? Sure, of course. And so a lot of it is something that we need to tease out. Is it situational? Do you have an exam coming up? Are you worried about your family? Some sort of stressor versus is this how your sleep has been for years? And then we need to figure out, well, if it's difficulty maintaining sleep, what is it that is bumping you awake? Is it your legs driving you crazy? Is it sleep apnea? Is it something external? Is it the train? Is it your bed partner snoring? It's really important to get down to it. I think we are excellent rationalizers when it comes to sleep. That, oh gosh, I'm tired. I will just go to bed earlier tonight. And because it's so slow and gradual, it often has been going on for a really long time before we seek medical attention because we've just blown it off as, well, you know what, I'm working and I have children and I have this and I have that and I have all these things in my mind and I don't think it's important enough to have evaluated. And so oftentimes we're unraveling years worth of poor sleep. And
a sleep study is the step to get there. Tell me more about that. If now I have to go into a lab and a hospital or a freestanding center and it's in a strange place and I've got equipment hooked up to me, how can that be an accurate representation of what it's like for me at home?
And that's exactly it. We get it. We get that it's a weird thing because there are a lot of wires and it is a strange environment. And I think at its core, sleep is very intimate. If we think about who we allow to see us sleep, it's people that we choose to. And so all of a sudden we're asking people to sleep in a sleep facility, a sleep lab with a total stranger watching them. And so we get that it's not necessarily going to be the same as your night at home. What we're looking for though is there something actionable? So most of the time when we're doing polysomnography or an in-lab sleep study, it's because we think that somebody might have obstructive sleep apnea or upper airways resistance or periodic limb moves of sleep, or maybe REM sleep behavior disorder where they are acting out their dreams. So earlier when we had talked about REM sleep, where we have those wonderful watching a movie kind of dreams, our muscles are paralyzed so that we don't act out those dreams. If we get into this mode of REM sleep behavior disorder, if somebody has this disorder, they lose that muscle inhibition. So they are acting out their dreams. And that can be very dangerous for their bed partner, right? It can be dangerous for them. And so these are the things that we're looking at on the sleep study. So we completely get that it's not your normal night of sleep. Totally understand. And we joke about it, right? Because it is a weird thing. And so sometimes you just have to have a sense of humor and just go with the flow. You know, we've had people post pictures on Twitter of themselves in the sleep lab. And, you know, you just kind of have to understand that it isn't meant to replicate your night at home. We're just looking to see if there's something that maybe is fragmenting your sleep that we can still pick up in that sleep study.
Well, technology has come so far now, I can do that sleep study at home. Is the quality of that data as good? Is that an option I should take if it's offered to me?
So the home sleep apnea test is only when we're looking for regular old obstructive sleep apnea. So none of the other things that we had discussed. If you ask the question, is a home sleep apnea test as good as an in-lab study? The answer is no. But if you ask the question, is a home sleep apnea test good enough for regular obstructive sleep apnea? The answer is yes, with a little asterisk. So most of these tests are measuring airflow. They're measuring oxygen levels. And so we're looking for sleep apnea, but they don't have EEG leads. So we're not measuring your sleep. And so the way that we determine severity of sleep apnea is how many times you hold your breath divided by the hours of sleep. Okay, so events per hour of sleep. And so it's just math. If we don't know when you're asleep, we use the value of the whole recording time of the study, right? Which we know you're not asleep the whole time. And so if you're dividing that same number by a bigger number, your overall number is smaller, right? And so home sleep apnea testing will underestimate what's happening. But again, if you have something objective on a home sleep apnea test and it tells us, hey, you're holding your breath 15 times an hour, that's actionable. Let's treat it. Now, if we brought you into the lab and it was 17 or 20, is that going to change anything? No.
Good point.
No, we don't want people to be professional patients. We have something there. It fits. Let's treat you, right? Let's see how you do.
So what about those home sleep trackers? There's the Oura Ring. There's a bracelet. I use a little app on a cell phone, put it next to my bed, and it seems to track when I'm awake and, the phases of sleep, that kind of stuff. Are those of any value?
I think it depends on how you define that value. So I actually love all of this technology because A, it makes people pay attention to their sleep. And then B, I think they're more vested and willing to improve their sleep. So if we ask the question, is it going to take over home sleep apnea testing? At some point in the future, maybe. But as it sits right now, the data is just not strong enough to do that. But if you have somebody that's struggling with their sleep and you make an intervention, right? So let's say like your patient you were talking about earlier that had difficulty maintaining sleep. And let's say we try a sleep aid. Is this a way that we can monitor it? right? And so we take it with a grain of salt. And so often what I will ask my patients to do is when you wake up in the morning, you write down how you feel. How did you sleep? Not how your Fitbit told you slept. And it's subtle, but there's a difference. Because if Fitbit says your sleep was really fragmented, then in your head, you're like, oh my gosh, my sleep was really fragmented. It must have been awful. Versus if you decide first, I think that's much more powerful.
Oh, I get that, because I'm one of those hacker addicts, and I'll take a look at my sleep chart and see, ooh, I was down on my deep sleep. And that you're right. There's a mind game. It works on you. It does indeed. Well, let's run through a couple of things real quick. I just want to kind of jam in as much as we can here. Should I go to sleep with a fan, a noise machine, the TV on, something like that? How does that help or hurt?
Fan is great. TV, not so much. And so, in medicine, perfection is the enemy of good. A lot of the time, there's a psychology with what we associate with our sleep onset. So if you're used to falling asleep with the TV on, you're going to notice its absence. We would prefer to shift you to something else. Can we get rid of that light, for example? Can we transition you to an audiobook or a podcast or something like that? It's part of creating that wind down routine and ritual. And so can we adapt that? Can we maybe do exercise earlier and some yoga and dim the lights in your home, avoid the devices, and really kind of create this lovely, relaxing wind down routine before we go to bed?
So should I have that personal question, because it happens in my family, should I have the sleep timer on the podcast? If that podcast is running all night, is my brain aware of it? Am I paying attention to it?
No, it's true. Have it on a timer. It's funny, I joke because I've started doing a meditation app, and right at the end of the 10-minute meditation, it says, "Thank you for joining us." And it wakes me up. And I need to email them and say, like, can you please stop doing that? Because I'm asleep when that sucker goes off. But yeah, we do see it and we do hear it. I'm sure you've experienced it where you've fallen asleep in front of the TV or something, and the content of the TV show appears in your dreams. Right? Or you awaken because of something that happened on TV. And so, yeah, we want our sleep space to be serene and quiet and dark and cool and comfortable.
Oh boy, that's a good one. Temperature is so important. And I have read that 65 degrees is considered the optimal temperature for sleep, correct?
Well, so it's funny. There are so many studies that come out, because one came out just last year, I think, where they said 82 was optimum. And I thought, oh my gosh, that's crazy. And so we know that as our body temperature drops, the quicker our body temperature falls, the quicker we fall asleep. And so that's where that idea of warm bath or herbal tea and then going into a cool bedroom, that's where that comes from. And that's what the data supports, right? Our hands swell in the evening because we're trying to release some of that heat, because we want to fall asleep and have a quicker sleep onset. Now bearing in mind that normal sleep onset isn't 5 minutes. Normal sleep onset is between 15 and 30 minutes. So if you're asleep when your head hits the pillow, that might suggest that you're actually a little bit sleep deprived, or maybe there's something else that we need to pay attention to. We all hate it. We all want to be really efficient sleepers and fall asleep in 5 minutes, but 15 to 30 is normal.
Really? Huh. I have found YouTube channels that are just crickets and night sounds.
Aren't they wonderful?
It is. That does it for me. And that can run all night. And somehow that seems better. And
there's a fan. Yeah. Yep, there's a fan. There's a crackling fire. Yeah. There's nap flicks. There's all sorts of things to help us sleep.
Nap flicks? I didn't know this. Tell me more about nap flicks.
And I think if I'm remembering it correctly, it's hours and hours of just the fan or the fireplace or something like that. And there are a number of sleep-related podcasts that have somebody just rambling on in a really monotonous voice or just telling stories. And it's just, the intent is for you to tune it out and go to bed.
Huh. Interesting. Okay, so what is the thing that we all do that is just wrecking our sleep? And I'm, the whole gadget thing, avoid the screens, let's move beyond that. But is there something else that really is wrecking our sleep?
Something that's come out of this pandemic is this revenge sleep procrastination. So where we know we should go to bed, Like I set an alarm on my phone that says, okay, it's time to start winding down. And sometimes if you're caught up in something, you'll just silence it. And I think we get in our heads, we get a bit childish about it where, well, I don't want to go to bed now. I want to watch another episode, or I'm having fun, or I want to have another glass of wine. And we delay our bedtime, but that rise time, right? We still have to get up in the morning. And so we are sabotaging ourselves a little bit because we are just unwilling to go to bed when we know we should go to bed.
Yeah. That's 10:30 is my time, and I'm trying to be very militant about that and just say, nope, sorry, time to go. But sometimes it's a challenge.
It is a challenge, right? Especially if you're with friends and you're like, oh, sorry, it's my bedtime. It doesn't go over very well.
Right. What are you, 12? Come on.
Exactly.
Yeah, right. So leave us with what you think. I mean, you've treated thousands of patients. What's the most effective way to help me stay asleep through the night?
Exercise. Exercise routinely is wonderful for sleep. Avoiding caffeine before bedtime. It's really just embracing the sleep hygiene, right? Like, let's be smart about our sleep and let's set ourselves up for success. So pay attention to your sleep environment. The bedroom is for sex and for sleep only. It's not your office. It's not the kitchen. Exercise routinely, maybe earlier in the day if it keeps you up, but if it doesn't, exercising later is fine as well. Avoiding that caffeine. Don't eat right before you go to bed, and go to bed with the intention of sleeping, not scrolling on your phone or watching TV. Be very intentional about going to sleep.
Oh, I think we have to leave it there, but thank you so much for your time. You know what? I'd like to come back and focus. We skipped around on a lot of topics, just a big overview today, but I might like to come back and connect with you and drill down into some more kind of finely detailed discussion of some of these topics. Can we do that?
Absolutely.
That'd be great.
Absolutely.
Thank you very much. It's Dr.
Thank
Seema
you.
Khosla. She is with the North Dakota Center for Sleep, also a spokesperson for the American Academy of Sleep Medicine. Glad you were here. Thanks a lot.
Thank you.